Are you dealing with hammertoes? Take a look at this picture. Does your foot look like this or resembles this in any form? Stick around, we'll talk about this and we'll talk about how we can fix this. Stick around. So welcome back to another video. Today I want to talk about hammertoes. Hammertoes can be really painful. They can look ugly and a lot of people are embarrassed by them. So let's quickly talk about what is a hammertoe and then we'll talk about what we can do to fix them. So let's use my hand as an example. Let's pretend this is a foot. And I'm showing it to you from a side profile for a very specific reason. With hammertoes, what will end up happening is that the toes will start to flex up like this. And let's just use one finger as an example. I'll use my index finger. We'll pretend this is your second toe. So what ends up happening is that the toe will start to flex like that. And you'll notice that the toe comes down, but then the knuckle bone is exposed. And that exposure of the knuckle bone can cause problems when it comes to shoes, causing a lot of rubbing against the shoes and can cause pain, but also it just doesn't look nice. And we live in an era now where aesthetics is everything, whether it's your face, your body, and even today, your feet. I have plenty of patients that are just embarrassed to show off their feet because they have unsightly digits that are contracted with corns and what have you, so they come to me for some help. But anyways, let's get back to the hammer toe. So essentially what ends up happening is the toe goes up like that. And let's look at this animated image right here. You can see the toe going up. It's showing a clear example of what the hammer toe looks like. But there's various forms of this. Let's look at another one. Look at this image right here. This is what we call a claw toe. We call it a claw toe because it almost looks like a talon, like on an eagle or a bird of any sort that has claws. What ends up happening is, so we'll look at my finger again. Instead of the toe just going up like that, what ends up happening is this portion now bends too. And now you have it looking like that. It looks like a claw, just like that. And again, patients get a lot of rubbing on the toes, but also on the tip of the toe, patients get callus buildup sometimes, and that can be very, very painful for them too. The other variation, the last variation, is what we call a mallet toe. Okay, let's actually look at this animated image here. You can see the mallet toe coming out straight, but then you see just a bend at the tip, just like that. Just like that. We call it a mallet because it's like a hammer or a mallet, where it's straight and all of a sudden it goes down like that. And a lot of times with this deformity, the patient's getting a ton of pain at the end of the toe. And so if you can imagine all your toes doing that or like that over many, many years, it can create problems. The big population that's affected by this is our diabetic population. And if you're not aware of diabetes, diabetes is a devastating disease and it can create a lot of problems. It creates a lot of problems for the feet because what ends up happening is that patients with diabetes end up with something called neuropathy. Now, neuropathy is a topic for a totally different video, but essentially neuropathy is where the nerves start to get damaged and the patient starts to lose feeling. Well, if someone loses feeling and they get constant rubbing day in and day out, what ends up happening is that they can create a wound, and a wound can lead to infection. Infection can lead to bone infection. Bone infection can lead to a lot of devastating types of events like amputation and even loss of life. So, there's the aesthetics part of things, but then there's also health reasons too, why this is an important topic to discuss and to be treated. So let's talk about what we can do from a conservative standpoint, first of all. So like my other videos, we've talked about shoe gear. Now, oftentimes with hammertoes, it's a problem in the toe box. So let's look at this shoe right here. The toe box is where the toes sit. Look at this right here. So if it's shallow, you can imagine that the toes are hitting the top of the shoe and there's going to be a lot of rubbing. And so an easy fix oftentimes is getting a toe box that's just a little bit taller, an extra depth shoe. You can find them with certain shoe brands, like the Dr. Scholl's brands. They do a pretty good job of making that. Another option for patients is utilizing silicone sleeves. You can get these on Amazon. Silicone sleeves can slip right over the digits, right at the area where the patients are having the rubbing, and it'll prevent some of the rubbing from the shoe. However, there's no way to get rid of this deformity without doing a procedure. And when I mean procedure, I'm talking about a surgical procedure. Before we get to the surgical procedures, I want to show you a couple of before and afters of what I'm discussing here. So let's look at this image right here. You can see this foot has, actually all 5 toes, including the big toe, are in this contracted state. And let's look at it now, before and after. You can see the before and the after right here. And you can see the big difference in the toes. The toes here are scrunched up And as a matter of fact, this patient was a diabetic patient and was getting what we call ulcerations or wounds on the tips of the toes. So this patient was at risk for an infection, and we were able to save him by just getting his toes nice and straight again. So let's quickly talk about how we can fix it from a surgical standpoint. Again, at the Art of Foot and Ankle, we utilize minimally invasive techniques. And so the incisions are really small. We call them keyhole incisions or poke incisions. Take a look at this right here. Here's an example of it. This is a real size, scalable, what the incision looks like. It's about 3 millimeters or 1/8 of an inch. And I utilize this type of incision throughout the foot to correct the deformities. And so what will happen is the patient will come to our office. We do our procedures in our office-based surgical suite. We get them in the chair. I do a nice anesthetic block. The patients are awake for the whole procedure, and so there's no need to go to sleep for this procedure. I will numb the foot really well, kind of like you go when you're going to a dentist for a filling or any dental work. Same idea here. And so what we'll do is we'll numb the area nicely. The patient's very relaxed. It's a comfortable experience, and I'll go ahead and fix the issue for the patient. Let's look at another example here. Look at the second toe on this patient, and now look at the after. You can see how there's straightening of the toe. It's no longer flexed anymore. So again, these hammer toes come in all sizes and shapes. And so I always tell patients, no 2 feet are ever the same. And so we create a custom plan for our patients after the procedure. But typically what will happen is the patient will come to our office, we'll do the procedure, and they'll walk right out in what we call a post-op shoe. Here's an example of what a post-op shoe looks like. There's no big bulky boot. It's a nice comfortable sandal that the patient will be in for a couple of weeks. And then afterwards I transition back to a normal shoe fairly quickly. Also, we don't use any orthopedic pins, screws, or plates. And so it's unique for patients because oftentimes that is what's utilized to fix these toes. With the minimally invasive techniques, we no longer need those implants. And so that also minimizes chances of infection. Sometimes you'll see, let's take a look at this right here. You can see the pins sticking out of the patient's toes here. This can create an infection because it's exposed to the outside world. And these are left inside usually for 4 weeks, maybe 6 weeks. And you can imagine if these aren't cleaned well, bacteria can seep inside the wire, and actually I've seen it where the wires get pushed in even further. So you're taking all that dirt, sweat, bacteria inside the toe, and I've actually seen some nasty infections because of that. So we've eliminated that with the orthopedic hardware. The other thing is that sometimes these implants need to be pulled out, but especially the wires. The wires have to be pulled out in the office. And that can create a lot of anxiety for patients, and I can totally understand why. Sometimes it's painful for them too. But sometimes when there's screws and plates inside the foot, after the surgery, after months of rehab, sometimes those plates and screws need to be taken out for various reasons. And so this also eliminates needing a second surgery to remove the hardware. So let's quickly discuss what are the advantages of having done the minimally invasive technique way. Well, number one, you walk the same day in a post-op shoe. So the advantage of that is that you're not off your foot for 6 weeks, 8 weeks, 12 weeks. So there's less chance of what we call a blood clot. When you move, we get healthy blood flow to the leg, and that allows the patient to, with the healthy blood flow going to the leg, it limits the chance of a blood clot setting in. Number two, infection. Infection's a big deal, and it can be common in the foot after surgery. The foot tends to be, as you may know, the dirtiest part of our body. It's sweaty all day long, and so there's a higher chance of infection setting in with the foot versus other parts of the body. So again, because of the small incision, we're not open to the whole world. There's no bacteria. Let me put it this way. There's minimal bacteria getting inside the incision. And so it limits the chance of infection setting in, which is, again, a big deal. Infection can lead to really bad things happening to a patient. Aesthetics. Let's talk about that for a second. So again, we live in an era where we all want to look our best, whether it's face, our body, and even our feet now. So the great thing is with this technique is that there's small scars, and in some cases, some patients won't even develop a scar afterwards. So it's almost like having the surgery without really showing anyone that you've had surgery with a big scar. And again, we live in an era where everybody's trying to look their best. Now, what's important after surgery is we get our patients into what we call an orthopedic insert. And I'm gonna make a video on this later, because again, this is another topic for another video. But for all my procedures after we're done, to hold the correction of the deformity that we're correcting, whether it's a bunion, whether it's the hammer toes or the Taylor's bunion like you saw in my last video, we utilize a foot orthotic. And what the foot orthotic will do is it'll keep the foot in a nice corrected position, and it'll hold that correction long term. An analogy I like to use is, let's say you have crooked teeth. You go to see an orthodontist, and the orthodontist will put braces on or Invisalign or whatever it is that you need done. Once you've had the correction, the doctor will put you in a retainer to sleep with, right? And so the retainer retains the correction. I use that same analogy for once we do the procedure, again, whether it's a bunion, Taylor's bunion, or hammertoes, once the patient's rehabbed, I put them in a forward orthotic, and I call that the retainer for the foot. Because again, it puts the foot in a good position. It'll put the toes in a better aligned position than what it was before surgery. Does that make sense? All right, guys. Thanks a lot for watching this video. If you have any questions, leave them below. Like, subscribe. And if you are someone that's suffering with hammertoes or really any foot deformity or issue in general, we help a lot of patients here with heel pain to bunions to unsightly toenail fungus. Check out our practice website below to consult with you. I treat patients all throughout the country and even the world. So I'd love to help you as well. Thanks, guys.